Dr. Mads Gilbert joins us live from Stockholm. He's a professor of emergency medicine at the University of Tromso in Norway, and he's someone who has trained doctors at Gaza's biggest healthcare facility, Al-Shifa Hospital, for 20 years. Doctor, great to have you here with us on TRT World. Now, you and I have connected on many occasions over the past few months, and I understand every time we talk, you are hopeful that the situation in Gaza might improve. The protests that are taking place across the world might have some sort of impact on Tel Aviv to stop its onslaught on the besieged enclave. But it seems to me, as each day passes by, the situation is only getting worse.
Well, unfortunately, I think you're right, but also bear in mind that it is an old knowledge that every time there is ceasefire approaching, the Israeli occupation army always increases and steps up the bombing markedly. So it could be a sign that the pressure on Tel Aviv is now so strong from the US that inshallah, we will have ceasefire in a short while. But that said, it does not help the more than 700 wounded from the Nuseirat terror bombing and attacks the other day. And I've been in contact with my colleagues at Al-Aqsa Hospital, which is now the only operational surgical hospital in the mid area because it's too far to go to Gaza European. And they say the situation in Al-Aqsa is beyond description. It's a slaughterhouse. And all of you who have seen the live videos from the emergency room in Al-Aqsa the last 2 days, you have seen doctors, nurses, paramedics, volunteers virtually wading in blood in order to try to give help to those who can be saved. So what we know now is that this attack produced more than 700 wounded, many of them children and women, and a lot of these war wounded will die from otherwise rescuable, treatable problems like bleeding, like infections, like an opened airway. Because in Al-Aqsa Hospital, there is currently only 2 operating rooms. And, these war wounds, they need surgery. And they also lack electricity and, as you mentioned, medical supplies. So the situation in Al-Aqsa Hospital and also in Al-Awda is beyond description. And we need now to get an international protection force, a military force, to protect the hospitals in Gaza, to safeguard the safe treatment of the wounded and the sick people.
And Doctor, we are also getting reports that World Food Program has basically paused aid deliveries to Gaza now. They say that there are security concerns. That's why they're not able to provide any sort of aid to the besieged enclave now. And that's only going to worsen the humanitarian catastrophe that Gaza is facing right now. Now, you mentioned that Al-Aqsa is the only operational hospital in Gaza right now. I wonder what happens to those who are injured in, for example, southern parts of Gaza. Correct me if I'm wrong, they basically die because there is no way they can get any sort of help.
A small correction, I said that Al-Aqsa is the only operative in the mid part of Gaza. There are operative hospitals in the north and also in the south. And of course, there are a large number of people dying, avoidable death, as we say in medicine, meaning that if you had a healthcare system working, they would not have died. And that goes not only for the wounded, but also for people with cancer, with diabetes, complicated pregnancies, and so on. These numbers are unknown. The excess mortality from ordinary diseases is also sky high. But I want to mention a little ray of light, because the Minister of Health in Gaza has informed me that they have been able to partially open a small corner in Shifa Hospital to start hemodialysis for the renal patients. They have also reopened Nasser Hospital. And yesterday we got the news that they actually have been able to reopen the operating rooms in the Indonesian hospital. So this all points to the bravery and the enormous work that the Palestinian healthcare workers are putting in order to safeguard some sort of healthcare to their people. But that said, the Minister of Health also urged the world to provide generators because, like now in Al-Aqsa, they don't have enough electricity. So they can only provide electricity to the operating room, to the ICU, and to the neonatal ICU. The rest of the hospital is without electricity. So generators are badly needed. And I urge your president to fly in generators to Gaza so that the healthcare system can maintain some level of operational function.
Now, Dr. Gilbert, you have trained doctors in Gaza for over 20 years. Now, this question, it might be a bit too early to ask this question, but I think it's a very important one. Gaza's healthcare system has almost completely collapsed. As a doctor who has served in the besieged enclave, how long do you think it would take for the international community to rebuild that system, to repair the damage that has been caused by ongoing Israeli attacks? How many years, how many decades perhaps we're looking at?
Well, that's a very important question. And I just like to say that it hasn't sort of collapsed. It has actually maintained a very high level of function despite the attacks from the Israeli occupation army. But as your reporter said, the attacks on healthcare has been so systematic, and the killing of more than 400, close to 500 healthcare workers, of course, has also weakened the healthcare system. Most of the hospitals are not flattened by bombing, but they are denied water, food, electricity, fuel, and medical supplies. So once the siege is lifted, and once there can be a free flow of supplies, medical supplies, and international medical teams, the Palestinian healthcare system can quite quickly be restored at some level. And then it will take, of course, as you mentioned, maybe 3, maybe 5, maybe 7 years to restore it, because the healthcare system on the start of this attack on the 7th of October was already on its knees as a result of 17 years of brutal Israeli siege, which has so badly also hit the healthcare system. So it was not the fully operative system that was suddenly attacked. It was a system that had been weakened and emptied through 17 years of siege. So yes, it will take time, but I think we need, as you say now, to focus on the rebuilding of Gaza. And we are thousands and thousands of healthcare workers all over the world who wants to support the re-establishing and the rebuilding of a functioning healthcare system in Gaza. And the moral compass today is held by the healthcare workers in Gaza, never yielding, never giving up, never leaving their patients.
Dr. Mads Gilbert, it's always a pleasure talking to you, sir. Thanks very much for talking to us here on TRT World. Really appreciate your taking out the time.